Welcome back to episode 8 of Let's Go Shorts. Today we are talking about the role of anti-obesity medications in the treatment of the disease of obesity. I am Dr. Peter Ammon, a medical bariatrician in Portland, Maine. There are currently 9 FDA-approved medications for treatment of obesity. These include stimulants, which were FDA-approved decades ago and only initially tested for short-term use. The rest of the medications are approved for longer-term use, which addresses obesity as the chronic disease it is. Several of these are combination oral medications, and the brand name version may not be covered by insurance and often are quite expensive. Using the individual medication in combination is considered off-label use, so the prescriber must be comfortable with the indications, risks, benefits, and how to monitor patients using them. As with other medications you may prescribe, following the start low and go slow motto applies. If you are starting 2 medications at the same time, only have the patient begin with one, then add the second after 1 or 2 weeks. The goal for these medications is a 5% weight loss at 12 weeks to show that these are effective. Also, medications need to be used in combination with lifestyle changes to be most effective. One of the older medications still available is Orlistat, which blocks fat absorption. So if the patients are able to follow a low-fat, lower-calorie diet, they can lose weight. If the diet includes a lot of fat, there can be significant unpleasant GI side effects. Enough said. Phentermine is a stimulant approved for the FDA for weight loss back in 1959. It is older than the Beatles, but still one of the most commonly prescribed anti-obesity medications. Like other stimulants, it can cause increased heart rate, blood pressure, insomnia, dry mouth, and like the ADD medications, is a controlled substance with a very small risk for abuse or misuse. It is only FDA approved for 12 weeks or less, but often used off-label longer term. A recent study of 300 patients showed an 11% weight loss over 1 year, and blood pressure and heart rate actually decreased for the patients. Qsymia combines phentermine and the seizure and migraine medication topiramate. In addition to the phentermine side effects, patients can experience paresthesias in their fingers and toes, increased risk of kidney stones, and brain fog at higher doses. Patients often note changes in taste perception for soda or beer, which may be a good thing. It is recommended to have monthly pregnancy tests if the patients can become pregnant. This is the usual titration schedule we use when we use the generics to create off-label Qsymia. Contrave was FDA approved in 2014 to treat obesity. This medication combines bupropion, which was initially approved for depression in 1985, then briefly taken off the market due to increased seizure risk at the higher doses, 600 milligrams daily, then reintroduced in 1989 with a maximum lower dose of 450 milligrams daily. In 1997, this medicine was also approved for use in smoking cessation and marketed as Zyban. Naltrexone is used for opiate use disorder and alcohol use disorder, and when combined with bupropion, the combination is FDA approved for weight loss. Patients often describe a decreased appetite with this medication. I will tell patients that though this medication also treats other addictions, there is no risk for abuse for this medication. There's a small risk for seizure, increased anxiety, and GI side effects, which should be discussed with the patients. This is one option for the off-label titration of the generic equivalents of this medication. Splitting the naltrexone dose to take twice per day, some patients have remarked may be more effective. GLP-1 receptor agonists are FDA approved for type 2 diabetes. They help patients with insulin resistance and slow gastric emptying, so patients feel fuller longer and tend to eat less. There also are 2 which are FDA approved for weight loss, liraglutide and semaglutide. The once-per-day liraglutide injection can be titrated every week if tolerated up to a maximum dose of 3 milligrams daily for obesity treatment. The once-per-week semaglutide can be titrated every 4 weeks as needed up to 2 milligrams weekly for diabetes or 2.4 milligrams weekly for obesity treatment. The oral version Rybelsus likely will be FDA approved in 2024 for obesity treatment at a higher dose than is used for diabetes. The newest kid on the block is another injectable called tirzepatide, which was FDA approved for diabetes in 2022 and for obesity late 2023. Studies for treatment of obesity showed an average weight loss of approximately 20% for patients at the highest dose at 15 milligrams weekly. For completeness' sake, the other two medication treatments currently approved for obesity are Gelesis 100, also known as Plenity, which is a hydrogel mixed in water and taken before 2 meals per day. It fills up the stomach so patients eat less. The last medication is setmelanotide, which specifically targets the MC4 receptor if patients have this specific genetic defect contributing to their obesity. Weight loss medications can be very helpful with lifestyle management, appropriate support systems, goal setting, and frequent check-ins to help patients improve their health by helping them to lose weight. However, medications can be expensive and have significant side effects that patients must be aware of. Also, supply issues with these medications can be a barrier to success. Patients often will gain back the weight when these medications are stopped, so often they need to be continued long-term, like other medications for chronic diseases. Also, these medications are often used with weight loss surgery, which is our next Let's Go Shorts topic.